Welcome, everyone. I was just on TikTok and I was talking to TikTok about why now is the time. We call September lock-in month, but actually on this day, we're calling this Monday motivation. So tap in. I want to discuss the changes from the NCLEX conference. I'm going back to the NCLEX conference because I think this is such great information. I'm not hearing it anywhere else. And so yesterday, I did a presentation for nurses in Africa, and I met with my partner, Paul, and we talked about how to come to America. And so for today, I'm going over this conference updates for my nurses in the United States and in Canada. Who is here in the United States and Canada? Let me know where you're from. Let me know where I'm speaking. I know I have someone from California in. We're talking about NCLEX conference stuff for the Americans today. Canada in the house as well. Excellent. And the reason why I want to do it from the American or the Canadian perspective is because you are the ones that determine how NCLEX changes. So if NCLEX is changing, it's because of you. It's because of you. You know how we know what is Pittsburgh. I see you. How we know what is important, Australia. How we know what is important is what new nurses are doing. So today I'm going to talk about what new nurses are doing in the United States and what they're not doing in the United States. I also made a prediction about NCLEX at home. I'm going to be making some more predictions about how I know the exam is going to be changing. So the first thing is I see you, New York in the house. I have also New Jersey coming in. Come on, let's talk about NCLEX changes on today. So we heard from many people at the NCLEX conference. And what I appreciated most, thank you for the hearts. Thank you guys for sharing. Smash that share button. What I appreciated most about this conference is that we heard from really the leadership in the NCBSN. We heard from the directors. We heard from the psychometricians. We heard from real live nurses. And this was the first time that many things happened at an NCLEX conference. I've been going to them for years. First time from the National Council letter. First time from the National Council letter that they encourage new nurses, hear me guys, nurses in the United States, to now go directly into med-surg, go directly into, I'm sorry, not med-surg, into ER, into critical care, not start in med-surg. For years, we have been telling nurses in the faculty, from the faculty position, how do you guys feel about this? We always tell new nurses, go into med-surg first. That's what I was told. That's what I did. Go into med-surg because in med-surg, you're going to get your training on how to manage a lot of different things. Well, this was the first time at the conference that they said, advise new nurses to go into the ER. What? Advise new nurses to go into critical care. What? Right out of nursing school. How do you guys feel like about that? Are there any people that will be doing that? You're going right into the emergency room. And so I was shocked at that because in order for that to happen, then that means there has to be resources to support new graduates in critical care. That means that there has to be more preceptorship programs or support services to be there for those new graduates. So for you who are taking jobs and who will be looking for jobs, that's one question you should absolutely be asking. If I go into ER, if I go into critical care, because I see some of you do want to do that. If I go into those units, what will my support be like? What will my support be like? So that was one thing at the conference that, we heard from the tops. The biggest question, though, at this conference and to date, as an LPN, I'm glad I started in med-surg. Me too. I mean, I'm happy that I got my med-surg experience because that really That really stretched me. Okay. The biggest question at the conference, what do you think the biggest question was at the conference for this year? People are still asking me about it. NCLEX at home, when will it be happening? And the faculty was just as interested in this question. Are we taking NCLEX at home? Where will it be? When will it happen? And we were all waiting to hear if it's going to be next year, if it's going to be 2026, if it's going to be 2027. And you know what they told us? They told us, as far as NCLEX at home is concerned, there's no date. There's no release date for this. And that's interesting because lots of controversy, lots of questions about this. And I know that I have people on here who are in support. How many people are in support? NCLEX at home. Let's do it. Let's do it. How many people are like, no way, no way? It's a lot of controversy on this. Okay. I like this. Nurse Virginia says, I would like to thank ReMar for helping me to pass the NCLEX-RN last week. You are indeed the best nursing review professor in the planet. Praise God. In the planet. I love that. Thank you so much for coming on, knowing where to find me. On Mondays, I do these updates, these coaching calls, all these things that I'm trying to help you to do. So I am very, very grateful to be a part of your journey. Thank you so much. And congratulations. Congratulations. Okay, so on TikTok, I am seeing people say, what are they saying? Yes, I want to. No way. I'm in support of it. I'm in support for those who need to have that choice. And for my YouTube, people are saying, no way. Not sure. No way. No support. Thumbs down, thumbs down, thumbs down. Right. And so actually, NCLEX at home will be a joke. Oh, I think that is the sentiment of what I felt at this conference. I felt that educators were confused. Educators were like, how did we get here? Whose idea was this? There were a few comments where the educators said, nobody asked us. How are you exploring this when nobody asked us? And I think that's true. When you talk about NCLEX at home, yes, it may be convenient. Yes, it may be flexible, but what will it do to our public image? Oh, will we be more respected, or will there be more room for doubt of our ability to provide care if we are allowing people to take NCLEX at home? Will we be more respected, or will we be less respected with NCLEX at home? That's a real question, right? And I like that. How did we get here? Okay. How did we get here? This is really great. You know, there are more things that are being done at home. Hey, listen, my online review is done at home. Right now, you can get a free trial to my online review. You can take exams. You want to get it? It's right there, right? So education at home is becoming more and more common. Okay. Education at home is becoming more and more common. And in some ways, it works for people. Like, I mostly work with repeat test takers. Most of you on here have failed NCLEX. Okay. You don't have to tell me how many times. You don't have to say how many times, right? And for the majority of you, in order to pass the NCLEX right now, all you need is probably a 6-week training course. The way I do it, that's it. Okay. But when it comes to the only licensure examination in the country, can we afford to have it done at home? You can go to, if you're on TikTok, you can look at my profile. You'll be able to get into it for free there. If you're on YouTube or Facebook, you'll be able to see the website right there. NCLEX Proctor and Home will be done the same way as ATI exams and all other exams, requiring full scanning of the room, a quiet room, no interface. We have to trust the process. And so that was a comment. I like this comment. That was a comment. However, there were instructors in the conference that said students are already cheating on those types of exams. Students are already cheating and they know that this will be an issue. And honestly, the biggest issue for NCLEX at home is not even, it's not even going to be cheating. It is going to be, are they going to be able to identify us correctly? For me, that's what I see. The biggest issue is going to be confirmation or verification of identity. Because you know that people say you look like somebody. Isn't that right? Some of us, cousins, family members, brothers and sisters, mothers and daughters, look so similar. Listen, you put a wig on me, I can look exactly like whoever you want me to look like in your family, probably. People mistake me for their cousins, their nieces all the time. We're talking about international people worldwide, through a 360 camera me, all you want, I still look like your cousin. All right. And that is going to be one of the bigger issues for me as a nurse educator, right? So many things. In the testing center, you're not leaving that room until you scan your palm. You're scanning your palm, you're scanning your palm, you're scanning your palm. At home, all I need is a webcam. You said your mother and her sister are twins. Come on now. How are you going to do that from home? What, you going to ask me for my ID? Okay, that's fine. Okay, so anyways, lots of controversy on this. And I think that we have to or NCLEX is going to have to overcome these big challenges about how it would make the profession look, the ability to verify someone's identity in a way that is secure, the testing environment, all these things, because you're talking about making this available for the entire world. But anyways, we're not talking about the entire world. We're just talking about the United States of America. So I wanted to discuss appropriately the technology that American nursing students would have to have at home and see if this is the technology that you are comfortable with. So we would have to have, for OnView, you'd have to have your own personal computer right at home. It could not be a Chromebook. It could not be, a work computer, maybe not even a school issue computer. This is what we're talking about. You need to have a webcam, a microphone, a single monitor, if you're talking about the technology that is required to take NCLEX at home. Also, you'd have to have a strong internet connection. How about this? No Wi-Fi. The internet that I have in my American home right now is Wi-Fi. They're saying if you do NCLEX at home, you should not use Wi-Fi for it. You need to have a hardwired line to do the exam on. I don't currently have that, right? So the ones who are saying, yes, I would do this, this is what you would be saying that you are willing to do. You can't go to a hotel room. You can't go to a library to do it. No public networks. Okay, literally, like I'm saying, what are we agreeing to? What are we saying we want? And then also frequently run through the testing requirements before your exam. Because here's the thing, and this is why I think no, NCLEX at home, they're considering this, they're exploring this right now. It's not a joke. It's something that is very much a very relevant issue for us in America. NCLEX at home is not for everybody. Like, this would literally be for a very privileged group of American nurses, as far as I'm concerned. Just because you, number one, have to have the system requirements, that's a minority. And then two, you're going to have the ability to have the resources that you're okay to repeat this test if something happens. Because if you're doing NCLEX at home and you have any issues with your technology, you lose signal, your computer shuts down, any kind of technical issues, your exam is going to be invalidated. And that's it. You failed the exam. So this is going to be for a group of people that, hey, they can take the chance of their computer shut down, you know, or they have control of their environment. Another thing for American students is we have to realize that our biggest hiccup, our biggest hiccup is not going to be probably our technology, because most of us in America, we can afford to have those things, right? You have your own laptop. You can get access to a hardwired line if you want to, right? But it's going to be this mentality that somehow, here are the challenges for American students, that somehow taking the exam is easier at home for you. When in reality, from the research that I've done and the way I understand it, taking the exam at home should be more stressful. It is not going to be what you think it's going to be. So you may think, okay, I'm going to do better because I'm at home. This is more comfortable for me. Sitting at home, though, sometimes can feel less serious than actually going to a testing center. Your casual environment may make you feel like I can just roll out of bed and take the NCLEX from home. It's not going to be like that at all. Yes, it puts the burden of any issues directly on you, because your proctor is going to be a person that's going to be online watching you. And if you say, hey, I can't get my computer to get started, that proctor is going to be like, I can't help you. Or you might ask, hey, am I supposed to, is my browser supposed to be doing this? And that proctor is going to be like, I'm here to just watch you take this test. Okay. So it's not going to be that, having a familiar space, being on your couch, being on your desk. No, you're going to have to be in a room. Okay. You're going to have to be in a room that has 3 walls and 1 window. Right. So 1 wall with a window, 3 other walls that are totally blank, nothing on them, no pictures, no nothing. I don't have a room in my home that qualifies for that. In my American home, most of the walls have windows in them. Like, you know what I mean? Like if there's 1 wall, it usually has 2 windows, or if there's 2 walls, there's 2 windows, right? And I do have things on my wall. So you would have to take down all pictures, everything. You know what I'm saying? Distractions, like you said, family, phones, background noise, all of those things are not going to be allowed. Yes, they will have to provide you have to use a specific software to be tested. I took the CNA at my house. It was hard. No bathroom breaks, so you don't turn around. Exactly. If we're talking about taking NCLEX at home, you are not going to be able to use the bathroom. And I know they haven't said that yet, but that is what makes sense. Once you sit down for this exam, and they're probably going to have to shorten the exam. How long was your CNA exam that you couldn't use the bathroom on? Right now, the NCLEX exam is 5 hours. If you are going to take it at home, I am prophesying right now. That was my prophecy that it would only be 2 hours long. Right? That's as long as it could be, because they're not going to allow you to they're not going to allow you to go to the bathroom, or they shouldn't. And if that's the case, if the exam is only 2 hours, here's another prophecy, they're going to have to lower the number of questions that will require you. It won't be 150 questions. I don't think that. If they're going to take it at home, then the minimum probably would be like 50 questions. That's a good question. Would you still have to pay the testing center? Should you still have to pay? I would think you would still have to pay, because somebody is going to have to process those results. Yes. Hey, I see you. Well, Gary said, shout out from Kenya. Yes. So yes, this is what I'm talking about. We have to think about what are the challenges, especially for American students, right? Sometimes I have here low adrenaline. Sometimes if you're too comfortable at home, you don't have that push of like getting up, going to the testing center, being kind of nervous because it's a new environment. But sometimes that adrenaline allows you to hyper focus, you know? Whereas at home, you're sitting there, you're like, okay, I can start my exam, and maybe you wait to the last minute and then all of a sudden your computer has to restart. You know how that happens where your computer all of a sudden has to restart or update. Oh man, isn't that so? So that's what I'm saying, just the mind shift and this. And these were the questions that I was ready to ask at the conference. And I'm sure other nurse educators were ready to ask, how is NCLEX at home going to be possible the way it is now? And the question was, we're not ready to talk about it. We don't have that information. Just the idea is on our minds. And people are like, why would you put that on the website? Right? Why would you have that on the website if you weren't ready to go into it? Way too early. But I think, this is the direction it will be going in. And over the next couple years, we will hear more about it. So right now, it's not possible NCLEX at home. But when it becomes possible, these are the things that have to be worked out. Yeah, if the power goes out, you fail your exam for any reason. If the power goes out, even if you have a generator, and I have a generator in my home because the power does go out in Ohio. The power does go out. So if that happens, if you lose connection for any reason, it's an automatic fail. I do think it's going to happen in a few years. I absolutely do. But I definitely think that the NCLEX is going to change drastically in how it will be presented. It will not be a 85 to 150 question exam. Cannot be. You won't get 2 breaks. It won't be 5 hours. They're going to shorten it. They're going to shorten it drastically when they provide it at home. Okay. All right. So we talked about NCLEX at home. It's not coming in 2026. It's not coming in 2027. It won't be in the next 3 years. I think they're going to start testing it. They're going to have to start beta testing this thing. They're going to have to start encouraging nursing students to try it out. Those brave nursing students, I don't know who they're going to be, but I bet they will be American. I know. The nerdy nurse says, so after Operation Nightingale, they thought it would be a good idea to make it at home. I think that offering the NCLEX at home could be part of them trying to prepare for maybe another possible pandemic. I've heard of that, right? But I also think too that NCLEX is a business and this is another stream of revenue because you are going to have to pay to take it at home. You may have to pay more. I don't know. I know that, price of NCLEX may go up. Really, for everybody that is watching this, you need to be encouraged to take NCLEX now. This is the NCLEX that you want to take. The reason why I am talking to you and spending time with you about this is because I want you ultimately to make the right decision. Okay. Number one, I'm committed to making sure that you are informed. I am committed to making sure that you feel comfortable. I'm committed to having this regular study group where you go through my course, you know what you're doing, you feel comfortable, you take the exam in its current form. I'm the only one right now talking about NCLEX conference updates. I don't know why, but I don't see it anywhere else. And I think there's nothing more important than understanding an exam that you're going to take, right? Yes, it has to be beta tested. And that's why when people were arguing and saying, hey, no, Professor Regina, why would you say it's happening now? It's not going to happen now. It's not going to happen now. Okay. So past this NCLEX, before all these things begin to happen, All right. So let's talk about, is there any codes for renewal? My subscription about to. Yes, there is a code for renewal. There's codes for renewal. There's codes for getting into my program. We're doing a discount coupon right now. All right. DM me. Yeah. Yeah. If you're at the testing center, and some sort of technology fails happens, you have justification right then and there. You're going to get support. You're going to get remediated. But do you know what happens if you're taking NCLEX at home and you have some sort of technology failure or something happens? You're going to get put into customer support line. And you know what that customer support line is? It is definitely a chat box. ah, all right. It's a chat box. So I'm doing the Tell Me Your Story Right Now promotion. Okay. So if you tell me your story, I'll create a special plan and we'll give out discounts based on that plan. If you told me your story like this weekend, we are still reading the stories and we want to make sure that you are getting individual attention. So please give us time because this was a very new promotion for us and many people are taking advantage of this. All right. So DM me, send me your DM me for the code. Yep, because your story will depend on kind of like your code. That's how we're doing it. All right. Hey, so now that we talked about NCLEX at home, I want to go on and talk about the next thing that I have prepared for you. Okay. Oh, Sheila, listen, definitely. Sheila says this in the comments, and I think this is important for everybody to kind of have this mentality because even in her frustration, which I can hear it, I think that you're ready to go to the next level. So you say, I don't care where I take the exam. I only want to pass it. I failed 7 times and I'm frustrating. It's affecting my mental health. Yes. And this is the reason why I want to speak with you. I want to hear what you've done in the past, what's worked for you, what has not worked for you. Thank you for the roses. Thank you for the hearts, everybody. This is why I'm doing this, because so many of us are stuck in that failure funnel. All right. And I want us to get out of it. And the failure funnel is just really recycling what you did in the past that didn't work. All right. Recycling what you did in the past that just didn't work. And you don't know what to do that next step. So I want to break that funnel. Okay. So let's talk about the changes that are coming. Now, know that we won't get the official plan until December. Okay. Right now it's September. So they told us we have some changes that are coming. We'll let you know in December. But I already know what those changes are. So I'm telling y'all those changes today. All right. These are the ones that I'm ready to stand 10 toes down on. So they said that the overall function, this is RN. I'm going to do RN. I'm going to do PN. RN. The overall format and the overall structure of the RN exam is the same. So that means 85 to 150, 5-hour exam, computer adaptive exam. Some of the changes that they're doing are they're going to add, excuse me, they're going to add new activity statements. Okay, y'all need to share this video because a lot of people don't know what I'm talking about. All right. Nice. I failed med surge twice. I'm taking your course this time. Let's go. Okay. So they're adding new activity statements. Now, what is an activity statement? Everybody should be asking themselves, what is an activity statement? When NCLEX says that, what does it mean? They're adding an activity statement in management of care, which is category number 1. They're adding a new activity statement in pharmacological and parental therapies. That's activity statement in category number 5 of the exam. This is for RN. They're adding a new activity statement in physiological adaptation. Okay. Activity statements are essentially things that nurses are doing. So we know that they're going to be questions on things that nurses are doing that they had not asked before. Okay? This is important for you to know. What are those things that nurses are doing? That's RN. So 3 new activity statements. Everybody, 3. For NCLEX-PN, everything about the structure, the format, the difficulty level is staying the same. Okay? They are going to add 3 new activity statements for PNs too. 1 new activity statement in coordinated care. That's category 1. 2 new activity statements in reduction of risk potential. So for PNs, there's a heavy focus on reducing patients' exposures to certain illnesses. And for the practical nurses, this makes so much sense to me because where are practical nurses mostly going to be working in the United States? Where do practical nurses mostly work? What kind of facilities do we need to now make sure patients are not getting complications in? Let me know in the comments. Nursing homes. Exactly. Most practical nurses are working in nursing homes, no matter what part of the country that you're coming to, right? You're in assisted living, you're in long-term care. That's where practical nurses are working. And with President Trump's changes and just the government's changes to Medicare, Medicaid, they are not paying for certain things anymore. So NCLEX is trying to, change and adjust our focuses. Okay. The RN activity statements was 1 in management of care. Let me go back to make sure I say it right. 1 in management of care, 1 in pharmacological and parental therapies, and 1 in physiological adaptation. Okay. New activities. So for PN, reduction of risk potential is going to get switched out. Now, why is this important? Because the activities are what reflects the exam. That's how I know what's going to be on NCLEX. It's because I'm doing the research and I'm reading. Right? That's also why I tell you guys question banks are not the best place to start when it comes to NCLEX. Yes, there's a center in South Africa, and then there's a center in Kenya, international. All right. So when I talk about preparing for NCLEX, the way I do it is I look at the foundational content, yes, based on the test plan. There's a reason why people take NCLEX 6 times, do my program, pass on the 7th try. It's because they're starting from the right place and they're not mixing together resources. Had a message on Facebook that I just saw glance. They said, hey, I used UWorld and I used boot camp, I think, and I didn't pass. It's been 3 times. Is this going to work? Well, you have to get out of that mentality of using multiple resources that are mostly question banks. Can't use question banks to pass NCLEX. Okay. All right. Send me a DM. I'm going to put my email address up too. Somebody put my email address up, please. Okay. So here we go. When you talk about the most activity or the most frequent activities that nurses are doing and the least frequent activity, I know, Janae, they tell you that in nursing school and they tell you to just do question banks in nursing school. And this is why, yes, I know. And this is why the NCLEX pass rate is the lowest it's been in probably 5 years, because the advice that nursing students are getting are from people who literally have not taken the NCLEX in 10 or 20 years, and they're trying to prepare you for the NCLEX that no longer exists. Okay. So my email is support@remarreview.com. if you want to send me your story, support@remarreview.com. And so this is why my job is so difficult, because by the time you get to me, you have probably taken NCLEX at least twice and you've spent probably about $1,000+. So me asking you to spend another $100 is the breaking point, right? But you will, I'll tell you this, if you get my program, you will have the content, the questions, and the support that you need, period. All right. Yes, you should get my nursing school program. You just started. So the least activities performed by nurses are those in prenatal and postpartum care. Maternity is the least that new nurses are doing. I'm expecting the maternity requirements to decline drastically, or at least they need to. They need to. They need to go down. Okay? Because new nurses are not doing maternity care. People that want to do maternity, are there anybody in here that want to do labor and delivery, maternity, NICU, anything like that? Right? The thing about your population is that once you do that, you don't want to do anything else. And so when you get into maternity, you typically stay in maternity, and then nobody else can get in there. And that's okay. But with other nursing disciplines, you do med surg, then you can jump from med surg to ICU. You can go from med surg to ED. You can go from med surg to operating room. But something about labor and delivery, new nurses are just not doing it. Okay. So that's what the activity statements are showing. The second, though, thing that I want to focus on is what nurses from both RNs and PNs are actually doing, what they're actually doing the most of. And this is what we should expect to see on the NCLEX exam in terms of increasing this portion of the exam. Okay. That's going to be, thank you for the roses. I don't even know what those mean on TikTok, but thank you so much for the roses. The most performed activities are identifying clients. You know, you have to do that every day as a nurse, no matter where you are. Infection prevention, infection prevention. Gotta know it. And this is, look at this. This is education. When we're talking about prevention, we're talking about education. And so whether you're RN or a PN, especially the PNs, I feel, they're going to have to change it to where practical nurses are expected to do education. Now it's the idea that only RNs do the teaching, right? That's what PNs are learning. They don't need to know education. That's not true. That's not true. Verifying medications to the correct patient. Okay. You need to be able to do that. What do you mean most performance activities? I mean that when NCBSN sent out a survey to 26,000 nurses, the results that they got back showed that new nurses under 12 months are doing these activities, the most and the least of. Okay. These are the things that you guys need to know. I don't want to come on here and just do practice questions with you all. I want you to have a deeper understanding of what is the expectation of you on this test. The passing rates are so low is because you go into this exam not knowing stuff that you should know. All right. And this will help decrease your anxiety. The more you know about something, the more confident you will feel. Okay. Yes, there's a lot of things going around about it. Okay. Passing rates going down. Yes. No NCLEX at home. Okay. So you guys, you can, those of you that are just joining, we've been talking for a long time. We've been talking for a long time. So you won't have to catch the replay. All right. I'm going to go on. So here is an anticipated nursing focus change. I said infection control. They are going to change this category to infection prevention. They're going to have to change and put a focus in on infection prevention. That's totally looking at something differently. That's the different focus, right? How is that different? Professor Regina, what are you talking about? Okay. What are you talking about? I think here's an old focus style question. I'm going to make it big so people on YouTube can see it. Here is an old style question. A client with tuberculosis, listen to this. I want you to answer it. This is the old focus. A client with tuberculosis is admitted to the medical unit. Which action should the nurse take first? Place a surgical mask on the client, initiate airborne precautions, start an IV for medication administration, or notify the infection control nurse. Talking about a patient suspected TB, number 1, place a mask on the client. 2, initiate airborne precautions. 3, start an IV for medication administration. 4, notify infection control nurse. Okay, see the answers on the screen. Correct answer, boom, 2. Initiate airborne precautions. Very good, very good. I'm doing easy questions, straightforward questions right now, okay? I just want you to see the slight change from isolation, control, infection prevention. All right, I think a new question would read like this. The nurse is teaching a group of parents about infection prevention for their infants. Which statement indicates a need for further teaching? Number 1. And remember, when I say a need for further teaching, when I write these questions, a need for further teaching means which statement is wrong. Okay. I'm adjusting the program. Which one should I get? Let me know where you are. Are you preparing for nursing school or NCLEX? Okay. A need for further teaching means it's wrong. Is it number 1? We will wash our hands before handling the baby. 2, we will keep the baby away from visitors who have colds. Is that okay? Okay. 3, we will give the baby all recommended vaccines on schedule. Or 4, we don't need to wash the baby's bottles if they look clean. Give the nursing school one. Okay. Number 4, right? Number 4 in this situation is wrong. We don't need to wash the baby's bottles if they look clean. Now, the reasoning behind it, and this is the position that I want you to take. We have now moved from, what should we do if somebody is suspected, or what should we do if somebody has a condition, to how do we prevent a situation? How do we prevent a situation? So if you're thinking about what that looks like in terms of nursing tasks, an old task would be contain, interrupt transmission, knowing the vector cycle. Okay. And what I'm doing is I'm giving you guys really easy examples. I don't want to make them difficult right now. That's not my goal. My goal is to help you to just follow along with me. New task is preventing exposures. How do we do that? How do we prevent exposure? That's the different focus. That's prevention. So right now we focus on, for the NCLEX as it is, isolation precautions, PPE, sequencing, knowing what to put on, putting patients in the same room. Okay, if you have this condition, can you match up with this condition? And notifying infection control. New focus will be on hand hygiene teaching, and not just teaching adults, teaching kids, teaching parents, teaching students, right? Immunization counseling. Y'all need to know that vaccine schedule. Know it in and out, right? Safe feeding, safe bottling, safe, those practices. Get familiar with that. Environmental cleaning. Bundle. I mean, there's so many things. I'm going to be developing this more out. But for example, somebody had made a comment on my live yesterday saying prevention is not something you can do in nursing. Like, you can't really prevent a patient from getting something in nursing. And I disagree. I think research shows us that if you have a patient with an indwelling catheter, you absolutely can prevent them from getting a urinary tract infection. there are certain things that you do as a nurse to prevent that from happening. Those are the type of changes that are going to be stressed. Okay. So right now, most of NCLEX is inpatient. That's where most things go, right? New will be inpatient plus home and then community. Community nursing. All right. Which action should the nurse take first, after TB is suspected or after it's confirmed? Which actions reduce risk? Those are kind of just the changes, right? This is one of the things that I'm anticipating. So look about this one. This is the NCLEX question. Different focus, new focus. A client arrives at an urgent care with a cough, fever, night sweats. Which action should the nurse take first to reduce exposure to others? Number 1, obtain a sputum sample in the ambulance. 2, place a surgical mask on the client, then move to a private room. 3, don an N95 and begin chest assessment. 4, place the client in a private room. What would you do? Client has urgent care, arrival, cough, fever, night sweat. Which action should the nurse take first to reduce exposure to others? Number 1, obtain a sputum sample in the ambulance. 2, place a surgical mask on the client, then move to a private room. 3, don an N95 and begin a chest assessment. Or 4, place the client in a private room. Which one? I see the answers on the screen. Yeah, I see the answers on the screen. So correct answer is going to be to place a surgical mask on the client and then move to a private room. Okay. Very important. We're talking about how we prevent risk to others. So just putting on an N95 mask yourself is good for you, but it doesn't necessarily prevent that spread to others. All right. So we have already updated this section in the V2Q bank. So if you go under the safety and infection control, it no longer says control now. It says safety and infection prevention and control. I'm being very proactive in this so that you're able to, see the differences in real time and actually do them. So I love that about the Q bank that we have, is that I'm able to make the changes and they go out to everybody at once. Okay. So work those kind of questions out. You should find them in there. We'll be putting more and more in this week. We just have to get to it. All right. Check them out. So my program, my online program, is available for everybody. It's a self-guided course that you can get started right away. And then we also have we also do our weekly check-ins. I'm going to be doing some new things for people in October, probably doing the 30-day challenge again, just to make sure that you guys are on track. Right now, all these changes that I'm doing are going to be in the NCLEX location specifically. All right. But I do have other programs you can try. But right now we're focusing on NCLEX. All right. A new question type before I let you go. All right. A new question type that I want to talk about that you may have heard, I don't know, but it is the multiple client or multiple patient case studies. So traditionally, when we first heard about case studies, it was one patient and you got 6 questions about one patient. Now, for NCLEX, you can have multiple patients. And this is why I'm telling you guys, you need to be taking this test now. Because even with them saying the structure is the same, they're going to be doing things like this. Okay. So the candidates now must use the clinical judgment measurement model to determine priorities of multiple patients. Okay. And this is within a case study. And I know some of you guys are seeing this. You saw this on your NCLEX. You saw this on, whatever. Some of you are seeing this in school, but it is a thing now. They are doing it. And I wanted to, kind of explain what we need to do. I'm going to be talking about multiple patient case studies because I have not seen these anywhere else in terms of what they look like and how to do them. So I got on this right away. We've added a few to our Q bank, and we will be adding more to them over the next week. So here's an example of what they look like. I did a TikTok video on this, but um, if you want to see it, go over to YouTube. Here's an example of what they look like. Now, what I want you to notice, I'm not doing a multiple patient case study right now. I'm just trying to show y'all that on the screen, this is the one that I wrote. You have patient's A information. Patient A, Miss Louise Garcia, age 68, a whole paragraph about patient A. And then right underneath that, you have Mr. Luis, and you have Miss Reed, age 78. She has a whole different issue going on. Do you guys see that? Now, this is just 2 patients. I'm starting you off easy. How many of you have had case studies with 3 and maybe 4 patients, or was it just 2? Okay. And the thing about these multiple patient case studies is that they are active right now on the NCLEX. Okay. They are active right now. And to me, just writing these, they can be very simple or they can be very difficult. Yes, you would have to know what the possible diagnosis is. And yes, you have to know the different symptoms. Um, and so you have to read it. And it's a bit of reading, right? It's a bit of reading. Depending on how deep you want to go into it. And so here's one where we did a case study. It's 3 tabs. So you would read the nurse's notes, and then you would read the medications. Okay, each patient would have a list of medications. You had 2 patients. Okay, I did one with 2 patients. And if you look at the medications, I wrote them as some of these medications you give with parameters. So you give after blood work is done, or you give if they have a certain pain level. And so if you are doing NCLEX, you have to keep these things in mind. Vital signs as well. Your patient should be presented with some sort of vital signs for 2 patients. When I tell you that even if they say the structure of NCLEX is not changing, they can add these new question types in whenever they want to. This is what is going to make this exam more difficult, especially if you've never seen them before, especially if you don't understand how this all works together. So if your question banks are not forcing you to understand how the content works together, you need to get into my program because we're already on this. Okay. We're already on this. Once you get used to doing these, familiarizing yourself with these, you will feel more comfortable when you see them on your exam. I don't know, you guys. I can't stress this enough. The NCLEX that you take now is very important for you to get whatever that next step is for you. You need to take it. Okay. Partial credit available to help you pass NCLEX. I love that we have partial credit now for NCLEX. I think it's very helpful. But right now, what I'm seeing is the overall passing scores are declining. They're declining, even with partial credit. So the investigation has to be made. Why does this continue to happen? I'll tell you why. 5 reasons, top 5 reasons nursing students fail NCLEX. They usually don't change. Number 1 is you're not using a content-based resource. You're using something that is focusing you mostly on doing practice questions. Okay. Even in the comments right now, people are asking me, how many questions do you have? Do you have readiness exams? And I know that it's because you're coming from a place where that was stress to you. Okay. Somebody told you just do questions, focus on questions. That's the number 1 reason. Okay. Second reason is the content that you do study, you're not making a connection with. You can sit and listen to an hour of a lecture, and when you're done with it, you have no idea what you learned. Could not teach it to anybody, could not repeat it again. And so you feel like you're doing work listening to content, but it's too long, it's too boring, it doesn't connect. That's the second reason. Third reason is, I would say, you're cramming, you don't give yourself enough time. Fourth reason, consistency is off. You've been studying for 6 months, you've been studying for 8 months, you've been studying for 2 weeks, and then something comes up, you put it down, you go back to it, you lose consistency. Fifth reason, final reason, has nothing to do with your intelligence. It's usually test anxiety of some sort, some physical, some emotional test anxiety. It meets you at the exam and it undoes a lot of work that you have been doing. Those are the top 5 reasons nursing students fail the NCLEX. My program is going to address all of them, every last one of them. Okay. Yep. I know it. I know it. So when we are thinking about this process, here is the truth. Okay. The exam that we have right now is relatively stable. It is an exam that at one point, 94% of people, almost 94% of people, hold on, they're trying to stop my live. Give me 1 second. TikTok is okay. At one point, 94% of people were passing this NCLEX that's out right now. So that is the one that I want you to take. I want you, if you have a problem where you stopped studying, you stopped trying, you stopped fighting, you stopped doing all this stuff, to get you where you need to be, I want you to start it again. That was why September was lock-in month. All right. You need to pivot, whatever. You need a study plan. I need you to send me a message. All right. Because waiting won't make it easier. Okay. The longer you wait to take NCLEX, the more difficult of an NCLEX you will take. The longer you wait to take this exam, the more difficult of an exam you are going to take. Now you have case studies with multiple patients. You didn't have that. You didn't have that. There are more question types that are coming out that are going to be different. Okay. I'm going to close up this. I'm going to close up this live because I've been going for a long time. I did not mean to go this long, but this was good. We had good interactions here. TikTok, I'll stay on a little bit longer and do some questions and answers because I know I have a lot of different population there on TikTok. So after this live, if you want to join me, jump on TikTok. I'll be on my TikTok channel. I want everybody in here who is watching, and for whatever reason, you don't know what direction you're going to go in, you can get a free account. This month, you can get a free account in my course. Super easy to do. NCLEX T's nursing school, whatever. Just go to remarnurse.com. You can get a account that has the content, that has the everything that I'm talking about. Try it out. Try it out for 3 days. Period. Try it out for 3 days. See if you like it and go on from there. But you must do something. Okay? You must do something because this is an exam that is evolving. And I think once you get into nursing now, the changes that will come after that, and it doesn't take any money. I don't ask you for your credit card or anything. So don't even worry about that. Right now, you just get into the account. The opportunities that are in nursing are big right now, especially for new graduates. They're coming up pretty frequently. Okay. And I know they have some programs that are even coming out next year for new graduates that are going to be so nice, but you're going to have your NCLEX passed. Okay. Yes. I'm really ready to do it. All right. I'm ready to start if you're ready to start. That's my position. And I already have my nursing license, so I don't know how difficult It is to get you to the next step. But if you check out my profile, click the link there, you'll be able to do what you need to do. Okay. All right. Before we go, this is Monday Motivation. I always do a motivational scripture to help you deal with sometimes there's enemies that we fight that are not physical, that are spiritual. And so I just want to acknowledge that part of it right now. Just with this thought of God's words can transform your thoughts. God's words can transform your thoughts. When you talk about having things like anxiety and fear, those are spirits. Those are spirits, and the Bible does directly talk about them. There's a scripture for this week that I'll be using to just guide myself, and I want to share it with you because it is one that I had to sit down and digest. And it's Romans 15:4. Let me listen to this one. Romans 15:4 says, "For everything that was written in the past was written to teach us, so that through the endurance taught in the scriptures and the encouragement they provide, we might have hope." And I see this as broken down into kind of 4 phases where it talks about where are we to get our instruction for living from? Is it out in the world? Is it on TikTok? Is it on Facebook? Is it from the government? Like, no. We have written scriptures to teach us how to live. The Bible says that we should not be living in anxiety, in fear. We should not be living worrying about tomorrow. You know what I'm saying? We're supposed to be able to understand that the past will repeat itself. And God has already seen the beginning from the end. I like it. I like it. I like it. Oh, man. And then it goes on to the next part, which is so that through endurance that we're taught in the scriptures. So that means that you're going to go through something in this life that will require you to endure. When you talk about being a successful nurse, this is the thing. There's so many nurses who get into nursing and then they get burnt out or then they become unhappy. And I saw a young lady on TikTok, a young Black lady, and she was like, "I'm depressed because I'm a nurse, and going to the job makes me depressed." And I thought to myself, man, I don't want that for any of the ReMar nurses. But I know why it happens. It's because the understanding is not there that you don't go into nursing without a plan. Because if you do, then what becomes of you is you get stuck in a place you weren't meant to be in. Right. And so sometimes in order for us to have a encounter with wisdom, we have to endure some hard things. But the Bible says that God never leaves or forsakes us. Actually, during those times, if we lean on him, we don't even have to use our strength. The Bible says that we will be kept in perfect peace if our mind is stayed on him. And I heard a pastor say, so it's not even your job to protect your peace. Your job is to keep your mind stayed on him, and God protects the peace. Come on now. And so we have to be willing to endure some things so that we can obtain wisdom. And the scriptures teach us how to do that. And it says through the encouragement of these scriptures right now, you might have what you lack. You might have the thing that anxiety tries to take away, which is your peace, which is your success. Also, you might have hope that your future is going to get better. You can't be depressed if you have hope that your future is going to get better. Lightness and darkness cannot dwell in the same place. So you have to pick which side you are going to reflect. And so, yes, this week may be extremely trying, but we're giving counsel on how we are to live our lives out daily. And just the question is, will you be obedient or not? because the blessing is in your obedience. Yeah, that's where the blessing is. So I just leave you a Monday motivation with just the idea that you don't have to figure it out. We've already been given a tool for instructions, Bible. Yep, yep. Yeah. The Bible is timeless. It's true for thousands of years. The beginning from the end is there. God's word never grows old. And you think about, you can read from Genesis to Revelations, and in Revelations, John is trying to tell us what the end times will be like and what the future will look like. And he's doing his very best because he's a man in biblical times, and he's trying to describe how people are paying for things using the palm of their hand, and there's no, there's things flying in the air, and he sees all these things, and it's like that's the future that we're in right now, and the Bible already tells us what will become. And we are worried about trying to control every part of our lives when we can't even see tomorrow. I like that. Bible, basic instructions before leaving Earth. Woo! Nice. That's fire. So yes. If we do our part, which is what? Keep our minds stayed on him, then he will keep us in perfect peace. That's it. Well, it's such a pleasure, you guys, to do this conference with you, this session with you, study day session, every Monday, every Wednesday. We get together as a community and we talk about and discuss things that really transform us and matter to us. And so I definitely plan to pull back a little bit and go inside of the V2 and do our private sessions in there more. I know right now I'm, in it, everybody sees me, everybody can see me. I don't ask you guys to pay for anything when I'm out here. I just ask you like the video, share the video, these things like that, right? But there are a group of my students that are actively studying in the V2, and I want to make sure that you know exactly what you're supposed to be doing. So I want you to have a blessed week. I will see you back here on Wednesday, 9 p.m. Eastern Standard Time. And we're going to get into this book. We're going to go back to this book. Okay. Bum, 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 bum. And we will be doing page. Does anybody know where we left off? Because we haven't been in here since last week. We are going to be doing page 21. Okay. And quick facts for NCLEX. If you have quick facts for nursing school, I don't know if this is in here. I don't have my quick facts for nursing school, but no, not cancer. We did cancer. We're going to do CPR, cardiopulmonary resuscitation. And there are some things that I wrote down in the book that I want to share with you as we walk through cardiopulmonary resuscitation. Let me see. I just want to see if this is in quick facts for nursing school. No, there's quick facts for nursing school too. But even if you don't have the book, you need to come. You need to come. Okay, yes, it also is in Quick Facts for Nursing School. So both books have it. Both books have it. So I'll see you. Okay. All right. I'll see you guys later. Have a blessed day. Have a blessed day. And what? I think we did cancer. I just want to make sure. No, we did cancer. We did cancer already. We moved on. Have a blessed Monday, you guys. I will see you later. TikTok, I'm going to do some question and answers for you in 1 second. But I want to get off here and say thank you. It was a pleasure being with you. And I will see you Wednesday night, 9 p.m. Eastern Standard Time. Okay, so if you're in California, if you are in Nigeria, convert that time zone. Okay, see you later. Bye-bye.